The charity fund in the sphere of social and cultural initiatives of Leyla Adamyan presents Reproductive Tomorrow of Russia, the health of school children is our care. Good morning, dear friends and dear colleagues. We wish you a happy holiday on the occasion of the Day of Knowledge. I believe that knowledge is power. It's the power of occupation, power of family, power of the profession, power of the state, and I'm very happy that we have gathered in such a big and beautiful team here. This is an educational university which demonstrates the latest achievements in science and practice, mostly in the sphere of reproductive health. Those who were not able to come can watch us on internet. Right in front of me there is a TV set, so I can see what we're saying, what we look like, and how great we are. For the next presentation, the floor is given to Yelena Andreeva. She is the director of the Institute of Reproductive Medicine. She is the head of the endocrinology department of Moscow Endocrinology Scientific Center of the Ministry of Health of Russia, and her presentation is about dysfunctions of ovaries in adolescents. The floor is yours. Dysfunction of ovaries. Good day, dear listeners. You have heard a presentation about boys. Now I would like to tell you about girls. So, what is the role of ovaries in the reproductive system? Let us start by telling that ovaries are paired. It's a gland which is located in the area of the small pelvis, which plays an important role for the hormonal and reproductive functions. A girl is born with a limited number of follicles, unlike boys who can generate spermatozoids all their life, and normally she has a very small number of follicles that she can use during her life. Therefore, girls and women have a menstrual cycle, which is a repeated biological process of preparation of the body of a girl or a woman for pregnancy. Menstruation must occur every month. A menarche is the first menstruation in girls, which most frequently occurs at the age of 12 or 13. In Moscow, it is usually 12 and 4 months. The earlier the menstruation, the more problems a girl may have in terms of her health, especially if the menstruation starts at the age of 8 or 10. Therefore, it is another good reason to be more attentive with respect to the health of a girl and go to a doctor just in case, and usually menstruation occurs until the age of 45. At the same time, we understand that there are cyclic changes in the ovaries and cyclic changes in the uterus, and all these changes under the control and regulation of the hypothalamus and pituitary gland, which is part of the brain, so all the illnesses come from the head in endocrine gynecology. It is absolutely justified because all the commands always come from the brain. Besides, there are a number of regulators in the hypothalamus and pituitary system which contributes to the menstrual functions. And if something goes wrong, then we have a problem which is called dysfunction of ovaries. It could be a symptom of some other illness, or it could be an autonomous endocrine illness. It is registered as a separate illness, which is disordered hormonal functions of the reproduction system. And the causes of these dysfunctions could be very different. It could be various endocrine disorders, hormonal disorders related to external irritants, wrong use of combined oral contraceptives, or some other medicinal drugs. Quite often it can be various stressful situations, everything that the body perceives as a stress. They all cause inflammatory illnesses in the body that will be discussed today more in detail. As you all understand, the same girl may have several causes combined. In hyperprolactemia, there is a suppression of the secretion of gonadotropin-releasing hormones. Hypothyreosis may cause problems. Hypothyreosis may also cause different changes and disorders in the functions of the ovaries, and a high level of insulin may also cause functional changes in the ovaries. Therefore, for screening or a quick test will look in these girls at TSH, or the hormone of the thyroid gland, testosterone, sex hormone binding globulin, prolactin, glucose, and insulin if necessary. If some disorders are detected, then a consultation with the endocrinologist is needed. And remember, as Dr. Leyla Adamyan said, it is necessary to lose some weight if the girl is overweight or obese, but to a reasonable extent, because everything that is perceived as a stress by the body may cause a disorder in the ovary functions on the other hand. Very heavy physical exercises must be avoided, as some girls are fanatic about going to the gym. The emotional profile must be normalized. The normal lower limits of the body weight index needs to be maintained. And a gynecologist must be consulted on the needed hormonal contraceptives. Once again, about inflammatory illnesses, anti-inflammatory therapies are needed, and they will be discussed today. And for you to know the possible ovary dysfunctions. Menstruations may be scanty, or they can be profuse, they can be rare, they can be very frequent, they may be absent completely, or there can be various menstrual bloody discharges. We have a classification which was adopted 6 years ago, which is used by all the gynecologists of the world. It describes profuse menstrual bleeding related to some hormonal pathology or organic pathologies such as polyps, endometriosis, tumors, or some hyperplastic processes, or even cancer, or non-structural changes related to the changes in the blood coagulation properties, related to ovary dysfunctions, as you can see it here, various dysfunctions induced by some medicines or by some causes that may not always be explained by the doctors. All these problems result in profuse and lengthy menstruations, which are called anomalous uterine bleeding, and which we have to detect. And here you can see the clinical manifestations of anomalous uterine bleedings of the puberty period. A girl may complain that she has very frequent pulse, or that she feels dizzy, she looks pale, she is feeling cold in the hands and feet, she has a feeble peripheral pulse, problems of urination, nausea, vomiting, fainting. There may be blood discharges from the vagina, but she may also simply keep silent, being afraid to tell her mother about her problems and not to quarrel with her. The length of the menstruation may change. It may become much longer, lasting 7 or 8 days, but being rather scanty, and we implement an algorithm of examination which is approved by the clinical recommendations of the Ministry of Health of the Russian Federation, and afterwards we provide medical treatment for these girls. A delay in menstruation is a disordered menstruation cycle. On average, menstruations occur from 21 to 35 days normally. If this does not happen due to some reasons, physiological, as shown on the slide, or pathological, it may result in amenorrhea, opsomenorrhea, or oligomenorrhea. So, amenorrhea is absence of menstruation for 6 or more months, and we exactly know that the girl is not pregnant, and she hasn't given birth, and is not feeding a baby with her breast, which may also be the case, as you have heard. Amenorrhea may be primary and associated with some genetic disorders or anatomic disorders, or with dysfunctions in the hypothalamic pituitary ovary system. It may also be secondary and associated with hard physical work, bad diet, various tumors, thyroid illnesses, including hypothyreosis, dysfunctional ovaries, and associated with psychological problems. Oligomenorrhea is a reduced blood discharge volume during menstruation. In other words, menstruation becomes much more scanty. The girl needs less and less hygienic materials in these days, and may be primary, if happening from the very beginning of menstrual cycles, or it may be secondary, when initially the menstrual cycle was normal. So we look at the clinic manifestations, we analyze hormones, we have to measure the body weight index, and look at the skin. We conduct diagnostic measures, as shown on this slide. I would like to note that according to indications, it is not only ultrasonic scanning, but also MRI, magnetic resonance imaging of the small pelvis organs. We have to analyze sexual and gonadotropic hormones, and afterwards we can determine the diagnosis. Obsamenorrhea means increase of the interval between the menstruations when the intervals last from 36 days to 3 months. I remind you that the normal interval is 25 to 35 days. It may also be primary and secondary. It is primary when it happens from the very beginning, and secondary is when it happens as a result of disorders in the reproductive system organs, and it often happens to girls who develop a syndrome of polycystic ovaries that will be discussed in the next lecture. And here you can see the clinical manifestations, and I draw your attention to frequent depressions in these girls, high irritability, and headaches. Therefore, we have looked at the reasons. Having studied these symptoms, we should determine the diagnosis and then assign some therapies to treat the ovary dysfunctions. We should know that there is a treatment with medicines which should be administered by us, gynecologists, involving, if necessary, endocrinologists, hematologists, oncologists. We use various hormonal therapies, and it may be a combination of estrogens, histogens, it may be pure histogens, it could be combined oral contraceptives if necessary. We prescribe cabergoline if the girl has a high level of prolactin, thyroxine if the girl has problems with a thyroid gland in the form of hypothyreosis. If the girl has a high level of testosterone, we treat it with medicines with anti-androgen effects. If there are dysfunctions in the carbohydrate metabolism, we prescribe medicines such as metformin. If the girl has an anemia, then we prescribe iron-containing medicines, provide surgical treatment, and if she has an oncological process, then we prescribe a specific treatment. So if we don't timely treat a girl who has an ovary dysfunction in the puberty period with all the earlier mentioned clinical symptoms, then it may develop or may have developed the problems with endometriosis, with oncological processes. She may have problems with blood coagulation system. A girl may have very early problems with uterine tumors, a symptom of polycystic ovaries, which will develop into infertility later. Thank you for your attention. Thanks a lot, Yelena. Dear colleagues, I'd like to say that the work of the obstetrics gynecologist, who always deals with reproductive problems that may happen in women, it is always accompanied by an endocrinologist. And it is always a great pleasure when an obstetrics gynecologist understands endocrinology so deeply. And thank you very much for your presentation. See you at the next conferences of the Open University of Leyla Adamyan.